My name is Shayna, and I will be performing my head to toe assessment today. Hi.
Hi.
My name is Shayna. I am the student nurse. I'm here to perform a head to toe assessment on you. Is that all right at this time?
Yes, ma'am.
I will be back. I'm just going to go perform some pain hygiene.
Okay, Shayna.
So moving on, I want to make sure that we run the water and that we wet our hands first before applying soap. When we apply the soap, we want to make sure that we scrub our hands. Also the back of our hands as well. And in between our fingers, you can sing happy birthdays to make sure that you are clean for the appropriate amount of time. Also your nails as well. And your wrists. So now we're just going to rinse off our hands. And after rinsing that off, we're just going to wipe off our hands. And using another towel, we're just going to shut off the water. So moving back over, would you be able to tell me your name and date of birth?
My name is Leon Laguerre, and I was born in October 1st, 1968.
And would you be able to tell me what month it is?
Oh, this month is like January.
January.
Yeah.
Okay. And would you be able to tell me who the current president is?
Mr. Biden.
Biden. And would you be able to tell me what season it is?
Season, it's like winter.
And do you know where you are?
Yes, I'm home.
Okay. The patient is alert and oriented times 5. Now, have you had any tinglingness, swelling in your body at all lately?
No, not that I know.
Have you had any pain recently? No. And have you had any nausea, vomiting, diarrhea, any signs, vision problems?
No.
No. Any coughing, shortness of breath lately?
No.
Any hearing problems?
No.
Do you wear glasses?
No.
Do you wear hearing aids?
No.
When was the last time that you urinated?
Around like 12:30.
What color was it?
It was like white.
Was there any pain or discomfort at that time?
No.
And when was the last time that you went number 2?
Around 8 a.m.
8 a.m. And what was the color?
It was brown.
Brown. Any pain or discomfort at that time as well?
No.
No? Okay. So getting started, I'm just going to inspect your scalp. With that, we're just going to look for any signs of cuts, bruises, drainage. Okay. So I'm just inspecting the scalp, and I do not see any signs of any cuts or bruises. Continuing, if I could just have you sit up for me, please. So now I'm just going to inspect your eyes. If you could just pull down and I'm just going to inspect your sclera, which is pink. And then there I see no signs of conjunctiva, and your eyes are white as well. You can let go. And now I'm just going to inspect your pupils. And your pupils are equal, round, and reactive to light. The size is about 2. And if you could just follow my pen for me. And your eyes are accommodating as well. If I could just have you take your finger, cover one of your nose and just blow. And do the other. And your nose patency is in place. And inside your nose, I do not see any signs of draining or any cuts. Your lips, for my initial assessment, your lips are brown and a little dry, but still moist. If I could have you open your mouth for me, please. And just checking for any signs of cavities, and I don't see any signs of cavities. Your mouth is moist, your tongue is pink. Now could you smile for me? Could you frown? Puff out your cheeks. I'm just checking your facial nerve. And then moving on, I'm just going to assess, inspect your ear. So I'm going to pull the pin up and back, and I'm just going to assess inside your ear. And your tympanic membrane is pearly gray. there's no signs of any drainage or anything like that. Now, if I could just have you just lift your neck up for 1 second, and I'm just gonna assess your trachea, which is midline. You can come back down again. If you could turn your head to the left at a 45-degree angle, and I see no signs of a JVD. Now, if you could turn back towards me, I'm just gonna do a little pinch here to make sure that there is no signs of any tenting, which there is not. Now, if I could have you hold out your arms for me, please. Okay. Push down. Okay. Push up. Just assessing your strength. And if I could have you just roll your shoulders around your wrists, and we're just going to assess your range of motion. Now, if you could hold out your hands for me, I'm going to pinch your fingers, assessing your capillary refills, making sure that they are within 3 seconds, of which they are. And now I'm going to begin starting to listen to lung sounds. Okay. Starting in the back, can I have you breathe in for me? And out. Breathe in. And out. Breathe in. And out. Breathe in. And out. In. 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 And your lung sounds are clear from the back. Before we move on, if I could just have you squeeze my fingers. There we go, just testing your strength. And now I'm gonna start listening to your lung sounds from the front. Okay, breathe in and out. Breathe in and out. In. And your lung sounds are clear in all 10 points. And now I'm going to start listening to your heart. Starting off at the aortic valve, aortic point, which is in the second intercostal space on the right. Moving on to the pulmonic in the second intercostal space on the left. Down to Erb's point in the third intercostal space on the left. To the tricuspid in the fourth intercostal space on the left. And then down to apical, which is in apical or mitral, which is in the fifth intercostal space on the left. And I will be listening for 1 minute. And your heart sounds very strong. Moving forward, if I could just have you lie back. Okay. If you could just lift one leg up for me, please. Okay, put it down. Lift the other leg up for me. Thank you. And put it down. If you could just push your feet against my hands. Okay, good. So I'm just going to inspect your abdomen. For my initial assessment, your abdomen is flat. I'm now going to begin to auscultate. As I auscultate, I'm starting off in the right lower quadrant, moving on to the right upper quadrant, to the left upper quadrant, and down to the left lower quadrant. And you have active vowel sounds. If I didn't hear any sounds of clicking, I would listen to each quadrant, or the set quadrant, for 5 minutes. But your vowel sounds are active. And I'm just going to palpitate, making sure that your abdomen is not distended or rigid, which is good. Moving forward, I'm just going to take off your socks.
Okay.
And I'm just going to press them aside just to check for any signs of edema, which I do not see any signs of any pitting edema. I'm going to check your capillary refills on your toes, making sure that they were within 3 seconds. Now, of course, I would put on gloves to do this as well. Now I'm just going to check for your pedal pulse, which is at the top of your foot, and making sure it is strong and bilateral. Checking for the popliteal pulse at the back of your foot, which is strong and bilateral. And throughout this whole assessment, I've been inspecting your skin. I do not see any signs of any cuts or bruises. And if I could just have you just get up for me, please. And just move your legs, just assessing your lower part range of motion, which is good. You can have a seat. Okay. And then just to finish up, I'm just going to check your radial pulse, making sure that it is bilateral, equal, and bilateral, which it is. Same for... Okay. And you are all set with your head to toe assessment. Do you have any questions for me?
Oh, thank you.
No? Okay. Thank you.